Welcome Sofía Ferreira, Innovation Project Manager, Sant Barcelona's Children's Hospital. We have Janene already on the stage, so please maybe take a seat. We have Tomasz Rudolf, the co-founder and the godfather right now of the K.I.D.S Foundation and the CEO of Doctor.One. And we have Pekka Kahri from HUS, who will provide and who will lead this panel discussion.
Thank you and good morning also on my behalf. So I'm Pekka, working in Helsinki University Hospital. I work with innovation in healthcare and outside healthcare for quite a while, both in the side of the hospital and also on the side of the innovation funding agency. So knowing a little bit both sides. But after this wonderful presentation by Janene, so we'll continue the topic of knowledge sharing and innovation together with startups or early stage companies, a bit more also in the general perspective. And with here we have Sofía and Tomasz on the panel as well. So maybe first we'll start by short introductions of those who've not been speaking yet. So Sofía, would you like to start? Please introduce yourself.
Thank you very much, Pekka. So hi to everyone, good morning. I'm really excited to be here today. I am Sofía Ferreira, I'm an industrial engineer and I'm part of the i4Kids team and the innovation unit at Hospital Sant Joan. And I started my professional career working in a big engineering company, developing medical devices. And I have to say that was great because it was the start of my passion into healthcare. After that, I moved to Qatar. I work in a children's hospital also, where I realized the powerful of being immersed in a clinical setting where you have the contact with the professionals and with the patients, and you really see all the things that need to be improved and all the potential of having creative minds working together and moving projects forward. When I came back to Barcelona, I decided to do the D-Health program from BioCat, which is based on the biodesign program. And I think that it changed your mindset because you start thinking about needs innovation, needs statement, and how everything needs to be based on a real need. And the D-Health program, I also founded my own startup with my partner, which we are currently moving forward. And I also had the great opportunity to join the innovation unit at Sant Joan and really understand the challenges in pediatric innovation and moving forward and pushing, to improve things in our hospital. Thank you.
Great to have you on the panel, Sofía.
Thank you.
And then we have Tomasz. Please, would you introduce yourself?
It's a great pleasure to be here today. I've been in the innovation space for 25 years now, started more on the corporate side, meeting the startups, working for 15 years on facilitating the innovation processes in big corporates, which led to setting up of the K.I.D.S Foundation, being the hospital side. We were trying to facilitate hospital as innovation agents in this ecosystem. And I've moved to the other side of the table with Doctor.One, actually having met my co-founder in the K.I.D.S Foundation. So it's a very special place for me. And yeah, excited to be here today.
Excellent to have you here. Janene opened her presentation with an excellent type of an attitude speech. It's like a can-do. There are things that we can do here, which is like the spirit that is really needed in innovation. Another like a bit of a myth busting I would like to put here is that the question of collaboration between big and small is not something that is uniquely for healthcare. That's a question everywhere. So, and it is also mastered everywhere. So we can also do difference there. But let's start talking about first the main topic of Janene's presentation about the needs and the needs of that early stage companies are trying to solve. How do we make sure, unless the need is really and the company is spinning off from within the clinic, how do we make sure that startups are working with real and important needs? Who would you like to start? What are the ways to start with that? Janene, would you like to elaborate a bit?
I love needs, so I'll talk about that. But, I think okay, so if you ask a physician, I'll pick on physicians since I'm one, what they need, they will tell you. It's just never the right one. So never take what they say at first thought, because they need a new NG tube. They need something small and incremental. They're not usually thinking in these paradigm shifting ways, which is what we need to be able to build a business and actually impact pediatric healthcare. So I would go in that with a grain of salt and continue to dive down deeper. Hospitals, unfortunately, my hospital doesn't tell you what they need, or it's what they need and it's small, but it's not necessarily scalable. So my recommendation would be not to just talk to one physician or one hospital, which I know none of you do, but to really increase the breadth and depth of the places that you're looking at. And you can do things like consortiums and have, hospitals come together and talk about their needs. And it would be wonderful if hospitals did that, because I think then there would be a lot more targeted influence. But also building teams like we do at Stanford Biodesign, where it's not just physicians or not just engineers or not just business people, but being able to combine all of those, I think, is critically important.
Great. Sofía, what do you think?
Yeah, I think just building on what Janene said, so those programs that are based on needs identification, I think that they're a very important source. But then I think that we also, and I'm thinking about innovation units in our hospital, we need to support the relation between entrepreneurs and clinicians, no? And probably try to try to change the way we receive startups in the hospital and the way clinicians receive startups. I mean, sometimes when we arrange a meeting with a clinician and with our entrepreneur, they're just thinking, oh, what is this going to sell me, no? Instead of thinking, wow, they are the people with the muscle to solve some of the problems that I'm having, and we have to change the mindset. And in the opposite way, the same thing, some of the startups, they just come to validate that what they are developing, has a lot of potential, instead of being open to be challenged and maybe to change a little bit the way that they are developing the solution. So I think that is something that it's in our responsibility, and that's probably an important thing to understand, that we really need each other. We have our different roles, and we have to understand that we need to collaborate in order to make sure that we are targeting real needs.
I couldn't agree more, because in academia, I've always been trained, industry's bad, don't talk to them. We've really gone the opposite extreme, right? And I'm sure it's hard for you to get into different clinics and hospitals too. So training as a physician, industry's bad, they only want to sell you things. Selling things is bad. But as I was trying to display, that's the only way you actually get things to patients. And we've missed that disconnect. So I think in academia and in hospitals, we really need to divorce the idea that you can do one without the other. They actually really need to be together.
Another important source of important needs could be the patient experience. And Tomasz, when we had the briefing before, so you said that your sort of one of the kickoff things was an experience. So tell me a little bit about what you feel about that.
Yeah, I mean, I think experience is, especially frustrating experience, is often the source of innovation. And that has been the case in my personal story of helping set up K.I.D.S, because I had my unsatisfactory experience in a children's hospital, and that what led to connecting other parents and say, let's have a voice as K.I.D.S Foundation and bring volunteers and help children's hospitals with the human capital they don't maybe necessarily have on board, but we have the innovators, design thinkers, whatever, so we can volunteer and help the hospitals define the solutions to the problems that we see. So definitely I see that as a great opportunity to embrace the frustrations and understand them and just see if they are shared, because if they are shared, then we can maybe jointly address. I think healthcare in general is a very tricky industry to innovate in, because the payer, the one that buys, is usually a different person from the person that uses it, and there are multiple users often, then, especially in a complex world as a hospital. Maybe in primary care it's simpler with maybe one or two stakeholders. Here there's a lot of them, yeah, which makes it really tricky, because the person buying something might not have a total clue of what they're buying. So I think especially here, it's super important to be clear who you're innovating for mostly, and what problem you're trying to solve, because there are just so many problems to choose to solve. And that has always been the struggle within the K.I.D.S Foundation team. If we are there to help solve problems in pediatrics and in the experience of parents and kids in the hospitals, which problems should we solve? And obviously you'll hear today a voice of the kids themselves from the research. We've asked employees, we've asked doctors and nurses, we've asked parents, obviously, and then you need to just decide what is really the problem to solve. I think that's the hardest part.
How about then when the source of innovative power often from early stage companies is some specific technological knowledge, which they are sort of trying to adopt to different types of industries, and that can be a source of like dramatic or radical innovation. But how would you recommend that these types of companies would approach healthcare to making sure that there is a need or they can find a need that their technology could help in?
So this is antithetical to the way I think, of course, as I told you, because I'm really needs-based innovation. And I actually think that if they have a technology, and I work with plenty of companies that do this, they need to go back and validate the true need and really go back to the point of which they're saying, okay, is this the right solution? And it's really hard to forget a solution that you're in love with or tied to. So that becomes very, very difficult. But I think it's critically important in pediatrics because we need solutions that are tailored to our patients. I am so tired of miniaturizing things because I can tell you a 70-kilo man is not the same as a 400-gram neonate. I know I've said that enough times, but like they're completely different and they have completely different needs. So why do we use the same ET tubes, the same blood pressure cuffs, the same everything when they don't have the same needs? So if the technology truly fits the need, great, but it's rare that that actually happens.
Others, do you have thoughts on that? I suppose you've all faced that situation.
Oh,
There's
I'm sure
excellent
we all have
technology.
thoughts.
Yeah.
I
Tomasz,
think in general, I run a corporate startup collaboration hub called The Heart for a few years, where we were trying to be the table where those meet and facilitating those discussions. And in order for those two parties to actually agree on something which leads to implementations, not just pilots, but long-term sustainable solutions, I think you need to have maturity on both sides. Just like with dating, if one of the parties is not mature enough, it will not lead to a healthy relationship. So I think on the startup side, you need to have that maturity in terms of, stepping aside, not falling in love with your ideas, ability to listen, and so on, like in the relationships. And on the other side as well, if a hospital or a clinician is on the other side, they need to also be open enough to listen, to understand, look beyond the solution itself, and trying to embrace the collaboration. And then magic happens from connecting those two parties. So I think in general, in terms of hospital or clinician side maturity, being open to the methods like your teaching, I think, is important. On the startup side, also improving your ability, partner ability, by learning to listen, learning to understand how to prioritize those needs. Those are not necessarily skills that all innovators have.
thanks. So you're referring to dating, so meaning that the too big an age difference might also be a problem, like in dating, or would it? It
is often the case that there might be, I mean, here humans, it's a human-to-human process, and obviously age might not be irrelevant here, but in general, young organizations are not smaller versions of big organizations. They're totally different. So a hospital is a very different creature than a startup. So they have different, even, mortality risk, because startups die like at 70% rate. So it's a very thing. While in a corporate, maybe, I mean, you will lose your job or whatever, but the corporate will continue at least for decades to come, oftentimes, not always.
Yeah. Sofía, would you have any thoughts on this?
Yeah, I just would like to add that I think that nowadays we are understanding how important it is to understand the market from the very beginning. And in most of the startups, there are engineers and techie people who love to create and to design and to build and to test. But really, it's important to understand that we have to understand the market. Is there somebody's going to pay for this? How many people? No, to understand everything beyond technology. And I think things are moving in a good way, because I can see that now some of the grants are providing some financing resources to understand the market, to validate this, to do some assessments, no? And I think it's a good way to understand that if you're developing something, you're developing something that really has a place, you know, to be.
That's an excellent bridge, in fact, to our next topic, which is about implementation. So as we all know, that the journey then to idea into first prototypes, then there's still the implementation part. So how to make sure that things move beyond the first pilot. So what do you think, what would be the ways that hospitals that are very complex organizations and early stage companies could work together to improve the chances of going beyond POCs? Who wants to start?
Well, I can start. I think it's important to understand how the procurement process works in a hospital, and not just by talking to a hospital, because, for example, in Barcelona, it's completely different if you talk to Vall d'Hebron, or you talk to Sant Joan, or you talk to other hospitals, no? So processes are different, and I think it's important to talk to them, but again, not with the vision of selling something, but with the vision to understand a process inside, no? And I think that this also has to be done in the very early stages of the development of the solutions, because it might have an impact on if you're designing a single-use solution, or if you're designing something that needs to be reusable. So sometimes we don't understand the impact of having those conversations from the very beginning, but we should do that.
Janene?
Yeah, I think going back to the Stanford biodesign process, the reason that we map all that out in the beginning is that so that you spend your time on the most compelling unmet clinical need that has the best chance of actually getting to patients. So I'd much rather spend 6 months trying to figure it all out and think about, can this overcome regulatory hurdles? Can this overcome reimbursement hurdles? And your best guess with the best, advice that you can get, then 8 years and find that out in 8 years from now. I think we'd all rather that. So I would suggest you figure that out as much as you can before you've even built a product, which is hard to do.
How do you motivate early stage companies and innovators to do that? Because that's sometimes considered the boring part of it.
Well, if they want to make money, then they need to think about that. And if they want to be successful and get investors, our investors are very savvy. They need to see a business plan. They need to see a pathway to sustainable business. They need to know that your IP is locked in, that you can potentially get reimbursement, and that it's reasonable. So they just won't get funding if they don't do that. If they want to engage with us, we would encourage them to, we provide biodesign coaching and other things. And if they eventually don't want to listen, well, then I think that's on their own, but I think they'll be a lot less successful that way.
Tomasz, what are your thoughts?
There's probably different advice for the startup side and the different advice for the hospital side to get ready and more partnerable. I think on the hospital side in general, having someone that actually has looked and mapped that process and has defined the path and maybe eliminated some of the obvious obstacles, like not even any idea of how to get it refunded or financed or get even the pilot financed. If the startup has to figure out it all themselves and nobody on the corporate side has any clue how to do it, then a corporation is a powerful source of different forces, and those forces are there to kill all the external disruptions of the system, meaning the startup. So anything that disrupts the status quo will be killed in an organization, unless it's designed to have an incubation space for those collaborations that help with all those questions, which many startups don't have. So I think on the hospital side, and in all the corporates we've seen setting up dedicated funds, dedicated acceleration teams or innovation teams that are the opening door and help you prepare for those conversations, find the right partner, because obviously you don't even know who to talk to about different things, and then have also international networks or inter-organizational networks to help you connect with the missing pieces that you might have. I think that's a strong ecosystem has that, yeah, and great big organizations which are great innovators are like Silicon Valley or are like Israel. They are very strong ecosystems, not just one-person decision makers. And the last point is, I think no innovation will be done without leaders on both sides that just see the future and can imagine it. And I think from the projects we've seen with hospitals and with innovators, they were all successful because there were great teams built of those two sides.
Picking up on the point of the role of like funding to build it up, I don't know, is this a big difference between the US and Europe, but I have a gut feeling that in Europe there is much more soft funding available, where those questions that are from investors, they are not posed early on. Do you think that this is a topic? Should the funding be like more directed towards really making these early stage implementation and scaling questions a bit more hard, or am I mistaken? Anyone want to comment?
I mean, there are two options. One is to develop the private ecosystem better, to the VC ecosystem, which countries like Israel and Poland recently has done amazingly well, with tens of VC funds being created here and developing beautifully the ecosystem. Or what you're saying is like make the public funding less easy to get, because then they will be forced to think more.
Or link with private.
or to connect both, yeah. And I mean, we are a venture-funded startup with 2.5 million so far raised in Poland and Germany for our solution. And obviously, the questions we get asked when you have like fundraising round, you have 50 interviews with investors. They keep challenging you, and we as a startup that started with pediatric cohort as our beachhead market, obviously we have been asked, okay, will you stay in this pediatric cohort because it's so small and whatever? It might be a good starting point. So we get questions about scalability all the time. I think the big challenge is to connect those skills in fundraising and in product development and clinical work in the startup team. Because if you have business savvy people and you have great clinicians and great product people building the venture, then you will have what it takes to build not just a prototype or a product, but to build a company out of that.
Can't agree more, but I just want to focus on this idea that this is a small market, because I think we just have to dispel this right now. I mean, 25% of the population is not a small market. They truly are 100% of the future, as James Wall likes to say, so I'll throw that one out there. It's just not small, and the idea is you can capture a much larger market share because there's not a lot of competition. If you're looking at a very niche area of cardiovascular medicine, you might get 5% of the market, something like that, but you can reasonably get a majority of a market in a pediatric space around the world. So we have to change the mindset of people like that. I know that's a diversion, but I think
that asks you to think global, which not all innovators have the guts to initially.
Yeah, or think about it as Europe, or think about it as, you know, different areas, which is why we need to collaborate.
Of course.
Sofía, did you have a...
Yeah, I just want to add that my thinking is that the public funding goes for the initial phases of the development, right? But the VCs enters in a stage where the company is a company, and the process from going to a research project into a company is quite complex. There are legal agreements, and you have to talk about complicated things. You have to create a company, and that's an important step, and it's a difficult one. And sometimes we find ourselves as innovators that we don't know how to do this. And if you have done this before, you know, that's the experience you have, but most of the times we haven't done it before. And then also we have the challenge that some of the research projects are born in a hospital, and then you have to create a private company from that. So that's a challenge, and I think it's just in the gap of going from public to private funding.
Thanks. Let's switch to a bit another subject, the benefit and quantifying and communicating the benefit of a solution. So the startups need to communicate to several types of stakeholders. You already mentioned payers or professionals or families. So how do you advise early stage companies when navigating this landscape of stakeholders and, you know, communicating what is the benefit of the solution? Where to focus, what to do? Who wants to start? Tomasz?
We all have something to say about this. Well, there's decision makers and there's influencers, and sometimes the decision maker is the 30-year-plus veteran nurse that is at the bedside, and you have to figure out who that is and who's your champion and who's potentially going to knock your technology out before it even gets a start, and it is hard. So first you start with the big. You know, you've got to start with the people who you really think are moving it. But I can tell you that how things are purchased within hospitals, that is a barrier that probably needs to change, because nobody in the hospital has any idea how things get purchased, which is crazy because they get purchased somehow, but we don't necessarily know how. So that just adds a whole nother complexity to stakeholders that I'll let somebody else tackle.
Yeah, I mean, just giving you an example of Doctor.One, we built Doctor.One to humanize healthcare by connecting the pediatrician or the physician with the patient beyond the visit. So just like a person, like an uncle or whatever, that you can always write to and ask your questions. And because we believe healthcare is a relationship, and it's impossible to have a relationship without connection. And a visit is an invention to organize healthcare, but it doesn't solve all the problems. So when we started to build that, we had to choose whose needs are we optimizing this business for, and as we build the DNA of the solution, we had to prioritize. And obviously everybody speaks of patient centricity, but we saw that in order to improve or make it possible for patients to connect with the doctors, we had to design for the doctor because it's their private time mostly that this was interfering with. If they gave their private phone to a patient just to help them as a person because they felt the system wasn't necessarily solving that need. So we decided we are doctor first, which is actually even reflected in our name. And obviously we see the clinics, the payers, or the insurance companies, everyone around that problem statement, but we just had to prioritize for a stakeholder. That is our number one focus initially, and then obviously everybody else is supportive in this, but we decided to solve our problem we had to pick a priority, because it's often hard and you can get lost if you try to listen to everyone and optimize for everyone. And I think part of why healthcare is so sick in many countries is that it's optimized for the payer and not for the physician and the patient. So we said, yeah, we'll optimize it for the relationship between the two, and we'll make those two happy, and then we'll try to design an ecosystem around them that makes it possible, but yeah, not optimize a system for the payer themselves.
How about then about communicating the value, not maybe optimizing and listening to everybody, but isn't it still important that early stage companies, they think that when the patients come and or the physicians ask that what is the benefit for my patient, so that they have a response there, or they have been thinking it out, or for the payers. But I understand your point, not to like go wherever some professional or stakeholder group says, but shouldn't they, however, think and learn to communicate to different stakeholders? What do you think about that?
Yeah, I mean, I'll just give you the example of Novinate building off of that. So the benefit to nurses is they don't have to make a tape bridge, their patients don't get an infection, and they can remove one catheter at a time. that makes their life better because they're not dealing with tape sticking to lines and then doctors being really upset that they pulled out the wrong line, et cetera, et cetera. So that solves their problem, makes it easier at the bedside. Physicians love the idea that it is sterile and it decreases infections and decreases migration. But those are two different arguments that you make because nurses aren't necessarily there every single day in our healthcare system, but the physicians are to see that migration over time. So that is a much more impactful meaning to them. But then you have to think about payers. Okay, so, and value committees. We haven't even talked about that a little bit, but we have extensive value committees, as I'm sure you do as well. And what's the value to that? What is the cost to the hospital system of eclampsia? What is the cost to the hospital system of additional line days, of not putting in a PICC line, of all of that? So you have to have all those arguments for all those different groups, if that's what you wanted us to talk about.
Thanks. Sofía.
Yeah, I just wanted to add that we have been talking about impact today, and how the Montana Impact Fund, it fits on the impact. I think it's really important to start working on understanding which is the impact of our solutions, but in ways that we can measure that, no? And for example, this is why we started at the i4Kids. We created a valorization program that there are workshop specifics for startups to work on the impact of their solution. And I think that's very important, and even more important in pediatrics, no? To understand the impact of our solutions. I remember I was in the CRASH program, in the acceleration program with John Collins, and he kept on asking, like, so what? So what? No, you need to be able to answer those so what questions, but with a focus on the impact that you're having on the patient. So I think it's important to try to start working on the impact in a methodologic way, no?
We ask, so what? And then who cares? Because it's really important, but it's also very off-putting to Americans when you say things like that. Yeah. So the students are always very upset when we say that. But it really is, so what and who cares?
Yeah.
Excellent. Then let's talk about the other side of the group, so the hospital capabilities. So what do you think, engaging with early stage companies, it requires specific competencies or specific people from the hospitals. So what should hospitals do in order to better be partners for early stage companies?
I can start.
Go ahead.
I think that the hospitals understanding the need of having an innovation unit, it's an important thing, as we have seen on the report that Faye was sharing. No, in some of the regions, the human capital it's really needed. No, that they need to understand that you need people trained for this. No, so that will be one of the things. And then I know that hospitals, we do have like. We are not moving in the speed of the startups, so we need to find ways to be faster and probably to have some frameworks of collaboration to make those collaborations easier. And I don't know if it's a cultural thing, maybe for people in Spain, but sometimes we bring important discussions at the end of the negotiation. It's difficult to open the discussion on intellectual property, no? But it's a big one. It's an important one, as well as the equity, or how we're going to get the return on investment. So it's important to have clear conversations, transparent conversations, because we are looking for a collaboration, no? And I think that those are some tips, that could help the collaboration of hospitals with the startups.
So dedicated units who know how to take these things forward. Other thoughts?
I mean, just to know how to navigate their own healthcare system. I don't think there's many healthcare systems that have people that can say, this is where you go, this is how you get a clinical trial through, you need to talk to these people, this is how you approach the value committee, this is the form you fill out. I mean, having a startup figure that out at every single hospital, especially in the pediatric space, is impossible. It is truly, it's possible because we've done it. So I want to stay on the positive side. It's totally possible, but it's totally unnecessary. It's a waste of time and energy and effort, and hospitals need to figure that out, including my own, so.
But these services are there often, but they are reserved for internal researchers.
Internal research, or they're so fragmented that they don't talk to each other. So, you have to have a point of contact. You have to be able to do that, which is kind of why we decided to do Impact.One very much outside of the hospitals, so that we could move fast like startups and not be slowed down by the hospital system, and insert where we can.
Picking up on a comment, Tomasz, you made earlier about that big organizations are excellent in killing anything that is disruptive. So as a logical thinking based on that argument would be that, no, you don't need dedicated innovation units because it makes things visible. Rather, you go under the radar for as long as you like. What do you think?
I think actually,
provoking a bit.
If you look at the most forward-looking hospitals like Sheba probably, or the many of US, but also the Polish pioneers here in Central Europe, I think it all starts with understanding the agenda of the leaders, and if the leaders are visionary, you can find some priorities like being the top hospital that's visible, that's talked about, that gets more money, that gets new funding for new initiatives, whatever. I think there are needs of the board that you can address with innovation, and if you, as the innovation leader, can address them and can communicate how our unit or activities will help you solve this, then you get top management buy-in to actually do initiatives, great initiatives like we are seeing here. So I think a key thing is to listen to the leader, read between the lines, what are the priorities, and create an agenda for an innovation unit that will be impactful, be it on the bottom line or on the quality metrics of the hospital or on its PR activities or funding or research projects that it's winning, and then just to build projects that address the patient pain points or that help you win. And I think anybody that has ever sold something to a corporate has identified that you need to build coalitions, you need to understand the priorities and package your innovation in branding and wording that actually is appealing to the decision makers.
So top level CEO support or strategic view that this is wanted and possible and beneficial in an organization. How do you do that? Like many hospitals are in, at least past few years, been from crisis to crisis. It's like COVID, it's like wartime, it's like anything. How do you do this in the times of turbulent things where it seems that organizations tend to focus, on their core thing, and innovation might be something that is in the fringes? What do you think about that?
I can share one tip from the practical side, from the startup side. When we were trying to pilot Doctor.One, and just to get credibility in the clinical world that our method of working with patients is actually appealing, it was very hard to go through procurement or processes in hospitals. So we actually joined forces with a stronger brother or mother or whatever, or sister, be it pharma, and we said, okay, we'll join forces on a joint project that pharma will push because of their priorities, and we will jointly propose it. And a project that was hard to implement in one hospital, like that, could be implemented in 6 hospitals because it came with an ally, and we came with the credibility and money and of an ally. So I think you need to build coalitions, be it international coalitions, because, okay, this is an international project with other children's hospitals, or this is an EU-funded project, or this is a project with pharma, or this is a project with someone else. If you are a young innovator with little influence, you need to borrow that influence from someone that has it.
Excellent.
I love that.
Excellent. Other comments, Sofía or Janene?
Yeah, I can add something. I think that they need to understand, the C-suite of the hospitals, they need to understand the value of the innovation, and to that, they need to understand the process, and that it's not going to be super quick and super fast, and it's going to be, you need years to do that, but it's going to have an impact. And also, I think that engaging people in the hospital, you break their routine, the clinicians and nurses, they love to be in co-creation sessions and think about what they could improve. So I think it's important to create this culture of innovation in your institution and educate them, because everybody can bring a lot of ideas to what we're doing.
Excellent, thank you. I liked how you, Janene, put the question of the market. So it's not a small market; it's the biggest market. But maybe we are agreed that it's fragmented. So it's like, so how could we reduce the fragmentation? How could we sort of make it more like a unified market? Who wants to? Janene, go ahead.
Well, Sofía and I have been chomping at the bit to talk about our own collaboration and why I'm actually here today, or why I probably was invited by you. So I think that collaboration is really important, and not just looking at it as US, or just not just looking at it as one country in Europe, but actually making those cross the pond collaborations as well. And so we have an awesome, very natural collaboration that we've developed where we have innovators forums, and she brings companies to present to my team, and we should bring companies to present to your team.
Yeah, of course.
To get into the European space so that they can understand what's going on in the US and access our patients and our experts, as well as vice versa. And so we meet monthly, and it's absolutely lovely, and we all are learning throughout the process as well. So we really appreciate that. But you can elaborate on it.
Yeah,
It's
yeah,
much more than that.
So yeah, as Janene said, the collaboration started very naturally, and I think it's great because we have the opportunity to connect the startups from the i4Kids to the US ecosystem, to understand their regulatory pathways. The Impact1 has an amazing thing is that they are able to connect their startups with the FDA, but in a private meeting, let's say, or no?
Like a chill private meeting where you can talk about anything you want.
Exactly, they can understand the process, no? And they can also bring projects in the US that are interested in entering the European market, no? So I think it's a great collaboration. Always, as we said before, you need to talk to professionals, not only in your ecosystem, but in other places, and that also gives the opportunity, you know, to connect people from different places, which is normally very difficult. So I think collaboration, it's needed, it's really needed.
And people are nice in pediatrics.
Yeah.
They just want to
Much
help our
nicer.
patients. So it's a pretty great space to be in.
Tomasz, any thoughts?
I mean, I totally agree. And within the K.I.D.S Foundation, when we were building it, as a group of volunteers, none of us is working in the children's hospitals, but most of us being parents and having experienced this and just working in business in different spaces, we thought, I mean, how can we influence and have the hospitals collaborate, because the challenge is shared among the hospitals. Sometimes there is some competition even between hospitals or physicians or whatever, but we are there from outside looking at this as patients and their parents, and we want the system to work. So what we did with K.I.D.S Foundation, besides running projects that are changing one area or the other, we run surveys that are making the need statements clear. That's one. Secondly, we are organizing awards that create a positive competition among hospitals to share their best projects and learn from each other, which is actually happening today for the third time with the K.I.D.S Awards for the best children's hospitals innovations, because we thought if we bring the directors and the innovators together, they'll learn from each other, they'll feel stronger, and we'll start building that ecosystem and that movement. And we're so happy after the first event, first edition of the awards, where we saw that actually, I mean, it's a small world, but we saw that they didn't know about each other's innovations among those hospitals. So making those connections, I guess, on a local level, even in Poland itself, was meaningful, but making those connections internationally among the startups doing this, researchers or physicians innovating, the innovation units themselves, but also the directors and heads of hospitals on the topic of innovation, I think is super important.
So to conclude, so it's all about also building relationships and also building relationships between individuals. So people, you know, people who know each other and see that this is something that you can work together, super important. We had our chairs there waving that I think we should be stopping, but for the final lightning round, so what would be your one takeaway for any startup or hospital for the closing of the session? So Tomasz.
I'm staying here saying no. I gotta be the policeman. And Tomasz almost wrote a book. He can talk for hours. So we really are
Never
out
doubt
of time.
that a group of committed individuals can change the world. In fact, it's the only thing that ever has. So just connect and join forces and just do it.
Team sport.
I don't know what to say.
No pressure, no pressure.
No, I just want to say that there are excellent professionals in this field, and just take advantage of the expertise of each one of them.
Excellent. Thank you very much for the conversation.
Thank you.
You.